It robbed me of all my happiness, all my life. It was just terrible. I want other women to avoid going through what I went through. So one day I decided to go to my local clinic to access my antiretroviral therapy drugs because I'm also HIV positive. I was very fortunate that when I went to the clinic, the peer educator who was at the clinic was actually talking about cervical cancer. That's when I could connect that maybe what was going through in my life as well could have been cervical cancer. So that's when I decided to go and visit the clinic where the screening was done. So I was able to see the difference between my cervix on the screen and the normal cervix that the peer educator had shown me. I was sort of scared. Even on myself, I could see that my cervix was not okay. It's not like today you take your specimen to the lab, tomorrow the results are out. It wasn't easy. I had to start pushing for my results. And here is a person who's sick, who's bleeding every day. You take your specimen to the lab, you are told, no, you have to wait for the results. I became so anxious. It took about 2 weeks or so. The doctor read through the results. That's when I was told that I had cervical cancer. He even said, you have cervical cancer in stage 2B. I must tell you, that was the worst day of my life because that was so devastating. I felt so bad because just to be told that I had a cancer, to me it was almost like a death sentence. I lost my mother to leukemia. I lost my dad to liver cancer. I had a sister who died of esophagus cancer. I have another sister who's actually a survivor like me. So to me, that word cancer, to me was automatically death. So to be taught that now we have cancer disease hospital in Zambia and there's treatment, there's equipment, that gave me some hope. I was very hopeful and looking forward to starting treatment. They said, no, we have to book you in because we have a long queue of women waiting for treatment. You can imagine the frustration, what was going through my mind. It was so terrible. So 2 weeks, we went back to the hospital, only to be told you're not starting treatment today. You have to go through other investigations because when they're doing radiotherapy, they have to aim exactly where the cancer is. So they booked me again, thinking after the SIM, I was gonna start treatment. It was not the case. I had to be booked again. Finally, that day arrived. My family was very supportive. They escorted me to the hospital. Because I'd lost my employment, I'd stopped working because which employer was going to take you in every day you're bleeding, every day you want to take a day off. Financially, I was actually down. I had stopped socializing, I could not go anywhere because you never know when I'll start bleeding. I just became weak. Then I said, am I gonna pull through? But I was so hopeful, I had a strong will to live. Then I said I was gonna go through this, and I did.
Cervical cancer is the most common cancer that we have in Zambia. Among women, cervical cancer contributes over 40% of new cancer cases annually in this country. Women who are living with HIV are 5, sometimes even up to 7 times likely to develop cancer of the cervix. Women presenting with cancer of the cervix in Zambia, diagnosis is done in the age ranges between 30 to 45 commonly. That means that women are coming in with cancer of the cervix in the prime of their lives when they're contributing to this nation economically, socially and culturally as well.
Like the saying goes, prevention is better than cure. Because if a girl child is vaccinated, then that's it. Because one will have prevented what I went through. The worst part is that when it starts bringing out symptoms, you'll have already gotten it. Because one will never know when one has the HPV virus that causes cervical cancer. So the best thing is go and have yourself screened so that it's detected and you avoid a lot of pressures that I went through. Who knows, it might save your life.
Over the next 5 years, we must ensure we are having 90% of these girls getting vaccinated. That we ensure that over 70% of these women are getting screened, ensure that women are getting treated.
And I'm sure there are still other women now who have not yet gone for screening because of fear. Because this is one disease, up to now, I still dread it. It almost claimed my life. Cervical cancer is deadly. It is terrible. You never know, through my story, somebody can be helped. I can touch a life out there.